Ordered to Care, The Dilemma of American Nursing, 1850 through 1945. Susan M. Reverby, author. Reflections and poster by Jennifer Volker. Susan M. Reverby's book, Ordered to Care, provides a kind of rearview mirror look at the history of nursing and its development from a duty in the home to a trade between the years of 1850 through 1945. It provides an outline for the evolution of nursing from a familial or Christian duty to the experienced but untrained nurse, and then the trained and developed nurse. This evolution involves a correlating development of healthcare institutions and services as we've come to know them today, and the nurse's integral part of that development. Finally, it explores at length the ideology, structure of training, and the struggles and difficulties of developing nurses' training models and standardizing that as well as the professionalism of the trade. In the words of the author, Ordered to Care is meant to be a contribution to the historiography of nursing, medical, labor, and women's histories, since nursing touches on all these areas of intellectual scholarship. In their presentation, Why History Matters, Historically Informed Nursing Practice and the Untapped Potential of Nursing History, the American Association for the History of Nursing provides a framework for historical exploration. It provides definition for history as pedagogy, evidence, and explanation. History as pedagogy shapes identity, thinking, and provides a safe space to explore sensitive topics. History as evidence bears witness, gives voice, and dispels myths. History as explanation provides context, explains the present, and provides a way to look forward. This book is a valuable tool in developing a historical perspective on both nursing and the world from which nursing developed. Ordered to Care provides a somewhat intimate look at the birth of nursing as a trade and then a profession. The circumstances of its birth are not pristine. It involves an honest, often unflattering look into the necessity of the work, how it began as work, often given to the castaways in society, the class division and sexism within its development. This unfiltered view, however, provides us with an opportunity to utilize that information, to shape our own vision and identities as nurses. It teaches us. The evidence provided within the book provides us with the truth. Nursing was a necessity born out of most familial homes. It originated as care provided in the home by the women of the family, and sometimes Christian women who performed the care or relief. It then moved to the public sphere. Where did these women who would become trained nurses come from? What was the average age? What work had they performed prior to nursing? These demographics and the testimony of these people help us bear witness to the experiences without clouding it with our own inaccurate retold stories or rose-colored lenses. What is the relevance of these stories without context? This book helps explain to us the plot and plot the information on a timeline concurrent with the other relevant movements and moments in history, so that we are able to put it into a context that is truthful and meaningful. It assists us in putting nursing, its struggles and growth, into historical context. It shows us what is happening today in our profession is not in a bubble. It provides us not only with understanding, but pride in the past and hope for the future.